Welcome to This Explainer. Today, we're stepping away from the endless headlines and the hype to look at the undeniable biological realities of GLP-1 medications. Whether you know them as Ozempic, Wegovy, Mounjaro, or Zepbound, there's absolutely no denying that these medications have fundamentally transformed our approach to metabolic health, type 2 diabetes, and chronic weight management. But what's actually happening inside your body when you take them? Well, we're going to map out the precise physiological shifts, the clinical evidence, and the absolutely essential lifestyle protocols that you need for long-term success. Okay, let's dive into this. Here's our roadmap for today. We'll start with the science of GLP-1, then move into delayed gastric emptying, the root of fatigue, managing gastrointestinal side effects, and finally, we'll wrap up with the GLP-1 lifestyle blueprint. Chapter 1, The Science of GLP-1, Rewriting the Body's Metabolic Signaling. At their core, these medications are what we call incretin mimetics. Now, naturally, your body produces a hormone called GLP-1 right in your intestinal L cells immediately after you eat. But here's the catch. Natural GLP-1 degrades in literally a matter of minutes. These synthetic drugs are engineered to mimic that hormone, but they stay active in your system for an entire week. It's kind of like a master metabolic dial. When this dial is turned up, it signals your pancreas to release insulin only when your blood sugar is high. It tells your liver to stop pumping out excess glucose. And crucially, it targets the appetite-regulating centers deep in your brain's hypothalamus to just shut down those hunger cues. And this brilliantly illustrates the current landscape of these powerful medications. Take semaglutide, for instance, which is marketed as Wegovy for weight loss and Ozempic for diabetes. It's a straight GLP-1 agonist, demonstrating an average maximum weight loss of around 20.7% in high-dose clinical trials. Pretty incredible, right? But then we have tirzepatide, known as Zepbound or Mounjaro. This one is a dual-mechanism drug. It mimics GLP-1, sure, but also another hormone called GIP. By activating two distinct gut hormone receptors at the same time, it actually delivers even more profound metabolic effects, yielding up to a massive 22.5% average weight reduction in trials. Chapter 2. Delayed gastric emptying, the mechanical slowdown of digestion. So when you take a GLP-1 medication, it actively reduces your gastric motility. Basically, that means the actual muscular contractions of your stomach become noticeably weaker and slower. At the exact same time, it constricts the pyloric sphincter. That's the little valve that lets food pass from your stomach into your small intestine. The result? Food just stays in your stomach for a significantly longer period. And this cause and effect relationship is precisely what prolongs your sensation of fullness for hours on end. It's also exactly what prevents those massive crashing spikes in your blood sugar right after a meal. However, altering the mechanical plumbing of human digestion for sure comes with a physiological cost. Because food is sitting in your stomach longer, your enteric nervous system really has to adapt. Looking at clinical data for Wegovy, we see up to 44% of patients experiencing nausea, particularly in the very early stages of treatment. It's just your body's natural, totally expected reaction to this sudden induced delay in gastric clearance. Chapter 3. The Root of Fatigue, Uncovering the Energy Drain. Now, this brings us to a really vital question. Why do these medications leave so many people feeling utterly exhausted, especially in those first few months? It's easy to assume the drug itself is acting like some kind of sedative on your brain, but the medical reality is far more complex, and actually much more controllable than you might think. So the crucial point here is this. The fatigue is rarely a direct chemical effect of the drug. Instead, it's the metabolic cost of how the drug changes your daily life. Think about it for a second. Your appetite is heavily suppressed, so you're suddenly consuming a severe caloric deficit. You might be dealing with that nausea we just talked about, which leads to drinking less water and mild dehydration. On top of all that, rapid weight loss forces your body to undergo massive metabolic adaptation. That exact combination, low fuel, low hydration, and high physiological stress, that's what's straining your energy, not the molecule itself. And the clinical data validates this experience perfectly. If we check the FDA prescribing labels, fatigue is reported by 11% of Wegovy users and 9% of Saxenda users. To put that into perspective, roughly 1 in 10 patients is going to hit this wall of exhaustion. So if you feel tired while on these medications, you aren't imagining things. You are experiencing a very documented statistical reality of rapid metabolic shifting. Chapter 4. Managing gastrointestinal side effects, Adapting to the medication. Getting ahead of this all starts with a foundational medical protocol known as dose titration, Or, in plainer terms, start low, go slow. You literally never start a GLP-1 medication at its full strength. For example, semaglutide is initiated at a subtherapeutic 0.25 milligram dose. Clinicians then escalate this dose roughly every 4 weeks. This structured monthly stepping stone approach allows your gastrointestinal tract, and specifically that delayed emptying mechanism, the necessary time to adapt. That dramatically minimizes your risk of severe nausea and vomiting. Now, while mild nausea is an expected part of that adaptation phase, we absolutely must be clear about the clinical red flags. Severe, persistent abdominal pain, especially if you feel it radiating to your back, is not something you just tough out. No way. This can actually be a sign of acute pancreatitis, which is a rare but serious complication associated with these drugs. Similarly, an inability to keep any fluids down for 24 hours requires urgent medical attention to prevent severe dehydration and even acute kidney injury. Chapter 5. The GLP-1 Lifestyle Blueprint: Nutrition and Movement Protocols. Now, what's really interesting here is how this completely shatters the whole magic pill myth. As Dr. Andrew Progogini rightly notes, failing to adapt your diet while taking a GLP-1 doesn't just stall your weight loss, it actively harms you. Because you're eating so much less volume, literally every single bite has to count. Poor diet choices on these medications lead directly to malnutrition, profound fatigue, hair loss, and the dangerous deterioration of your actual muscle tissue. To combat that muscle loss, this right here is the absolute most important number you need to remember: 1.2 to 1.6 grams. That is your daily target of protein per kilogram of your body weight. When you lose weight rapidly, your body doesn't just happily burn fat. It will eagerly consume your skeletal muscle for energy if you don't give it a compelling reason not to. Hitting this protein threshold isn't just a suggestion, it's medically necessary to preserve your metabolic engine and prevent severe physical weakness. So what does the definitive lifestyle blueprint actually look like in practice? First, you prioritize that high-quality lean protein. Second, you must incorporate strength and resistance training to further protect that precious muscle mass. Third, hydration is totally non-negotiable. Aim for 2 to 3 liters of fluid daily, ideally with added electrolytes to help counteract the nausea and the fatigue. Because your stomach is emptying slowly, you need to transition to eating smaller, more frequent meals. And finally, you absolutely must avoid high-fat, fried, or heavily spiced foods. Otherwise, that delayed digestion we talked about earlier will turn into severe acid reflux and vomiting. Let's move to the timeline and see how this all builds across the patient journey. Understanding this flow is the key to your psychological resilience. Weeks 1 through 4 are usually the toughest. This is when gastrointestinal side effects peak as your body reels from the new metabolic signals. But you have to push through, because by weeks 4 to 8, a physiological adaptation called tachyphylaxis begins. Basically, the stomach gets used to the drug, the nausea fades, and that crushing fatigue diminishes. By week 12 and beyond, the glycemic benefits are totally maximized, your energy returns, and your weight loss trajectory stabilizes. These medications are a scientific marvel, an incredibly powerful paddle for the canoe of your metabolic health. But remember, they are only the mechanical advantage. The true longevity of your results depends entirely on you. As GLP-1s fundamentally rewrite your metabolic baseline, are you prepared to permanently change how you eat, move, and live to actually sustain it? Thank you so much for joining me on this explainer today, and I highly encourage you to discuss these biological insights with your healthcare provider.